Morning, everyone. I'm Conor McCarthy, the CEO of St John of God Hospitaller Services Group. I'm delighted to welcome you to day one of our three-day research event. While this is an annual event in our calendar, this year's event is different in two respects. Firstly, and by necessity, we have changed the format radically. And secondly, this year is extra special for us as we are celebrating our 30th Research Study Day. The format change is necessitated by the restrictions resulting from the COVID pandemic. Initially, we were disappointed that we couldn't follow the traditional conference format where everyone gathered together for a day in a conference centre. However, we soon came to realise that there are significant benefits to the format that we are using, with webinar events on 3 consecutive Tuesday mornings. One benefit is that no one has to travel, but probably more importantly, we are able to facilitate much greater participation and cover a wider range of topics. The second significant difference that I refer to is that this year we are celebrating 30 years of research. It's a hallmark of the St John of God organisation dating back to the founder, to seek to identify unmet needs and to look for ways to improve the services we provide. That approach is probably best exemplified by the research conducted by DETECT. That's our service for early intervention in psychosis. DETECT runs one of the longest prospective first episode psychosis studies in the world. To date, their work has impacted over 1,000 individuals and has resulted in hundreds of research publications. DETECT has also informed the development of clinical programs nationally and internationally. You'll hear more about this on day 3 of the series, which is 2 weeks from now. Researching emerging and unmet needs has been more important this year than ever before with the impact of the COVID pandemic. And next Tuesday, on the second day of the series, we will look closely at the impact of the pandemic on the mental health of all age groups and on the well-being of the men and women attending intellectual disability services. The pandemic has had a major impact on our services. We've experienced a dramatic increase in admissions and referrals to our mental health services, and regrettably, we've had to suspend our respite and day services for our service users with intellectual disability. The toll on our staff and on those we support has truly been enormous. But the pandemic has challenged us to look at new ways of meeting the needs of the people we support, and our teams have responded with innovative approaches. There are many examples of innovative approaches, including the work done across our ID services in organising through Zoom a wide range of engaging and exciting activities. And in our hospital, we have developed the Living Well in the New Normal programme and switched the mental health first aid programme to online training. We must now, of course, ensure that these initiatives and initiatives like these are evaluated through high quality research, providing a robust evidence base for their use in the future. On the 24th of November, and that's the third and final day in the series, we will look more closely at innovations like these, and we will highlight how the research that we have supported over the past 30 years has influenced the evolution of mental health and intellectual disability services, not just in Ireland, but across the world. During the series, we will look at what we have done over the past 30 years in forwarding the human rights of those we support. The research we will showcase and our panel discussions will assist in guiding our services in the future. Our commitment to research remains strong. Over the past 15 years, the St John of God Research Foundation has awarded over €1.5 million to fund research in the areas of mental health and intellectual disability. And over the next 4 years, we will award a further $480,000 in grant funding. We are also encouraged by the government's commitment to increased funding for mental health and intellectual disability services, We believe that the research that we have undertaken in the past and that we plan for the future will provide valuable insights into how the available funding can be spent to deliver the best possible outcomes for the increasing number of our fellow citizens that are experiencing mental ill health, and for those who experience disadvantage through intellectual disability. A core value of our organisation is hospitality. Our full title is St. John of God Hospitaller Services Group. The format we are using today puts some constraints on how we can express our hospitality, but we do offer you a very warm welcome, and I would like to express my appreciation to the large number of expert presenters and to those who have agreed to chair the sessions. Today, we begin by shining a spotlight on the protection of human rights through the provision of mental health and intellectual disability services. Our speakers will discuss the ethical and legal framework under which care is provided, the personal perspective of receiving care, and the challenges encountered in providing services in a changing environment. But before I hand over to the chair for our first session, I would like to acknowledge the great support provided to our research team by Dr. Ruth Barrington and our fellow directors, and by our Research Ethics Committee chaired by Professor Mary Clark. I particularly want to acknowledge the work of the research team led by Dr. Leslie O'Hara. Leslie, together with Dr. Anya Kelly and Peter Gallagher, has developed a truly great program using technologies that are new to us. I know Leslie would also want to acknowledge the support of Patrick Quinn and the organising committee. So many thanks to all involved. I'll now hand you over to the chair for the first session today, Dr. Larkin Feeney, consultant psychiatrist and clinical director for our adult mental health community services. Thank you.